Hey everyone! So if you're gearing up for that NHA phlebotomy exam, you are in exactly the right place. We're going to dive into the professional, ethical, and legal standards that are absolutely critical, not just for passing the test, but for building a great career. Let's get right into it.
All right, so here's our game plan. We'll start with the foundations of professionalism, move into cultural competence and inclusive communication, then cover the big ones, patient rights and HIPAA. We'll wrap it all up by talking about your professional image. Let's start at the top.
First up, professionalism. And I know, it sounds like a buzzword, right? But it's so much more than that. It's really about the consistent, trustworthy behavior that makes a patient feel safe. And, when a patient trusts you, they're calmer, more cooperative, and that directly leads to a better, higher quality specimen.
So you might be asking yourself, why is communication such a huge deal on the CPT exam? Well, the answer is simple. Bad communication can lead to some really bad outcomes. Lab errors, anxious patients, and even serious safety risks. Bottom line, being a clear communicator is just as vital as finding a good vein.
So let's break this down into the 5 key skills you've got to know for the exam. Verbal clarity, like double-checking a name and date of birth, prevents major errors. Your nonverbal cues, things like a calm posture or a reassuring tone, can literally change the energy in the room. And then you have active listening, empathy, and respect. These are your tools for making that human connection that ensures a safe, successful draw.
All right, building on that foundation of communication, let's talk about cultural competence. This is all about being able to adapt your professional approach to meet the needs of every single patient you see.
Cultural competence isn't some vague idea. It's about real, specific actions. It's knowing when to say, hold on, we need an interpreter to ensure proper consent. It's respecting a patient's request for modesty because of their beliefs. It's even understanding that things like eye contact can mean different things in different cultures. Taking these steps is just part of doing the job safely and with respect.
Okay, let's talk about personal space, because as a phlebotomist, you're going to be entering it a lot. Think about it. You start in that social space to confirm their ID. Then you move into their personal space to explain what you're about to do. And finally, with their permission, you enter their intimate space to perform the draw. The key here, narrate what you're doing. It helps the patient feel like they're still in control, which can make all the difference.
Okay, exam tip right here. You are definitely going to see scenario-based questions on this stuff. They won't just ask you to define cultural competence. They'll give you a situation and ask, what do you do now? So you've got to be ready to apply these concepts in a practical, professional way. All right, let's move on to a really critical topic, not just for your exam, but for practicing healthcare today: gender-inclusive communication. This has become an absolute baseline for professional standards. This table breaks down the absolute must-know terms. It's on you to use a patient's chosen name and to make sure their dead name is never used or seen. It's your job to ask for pronouns and use them correctly. And hey, if you make a mistake, it happens. The professional response is to just apologize quickly, correct yourself, and move on. No big drama. The goal is always respect.
It is so important to get this one right. Dead naming isn't just a simple mistake. It's an act that can genuinely cause harm. It can completely shatter any trust that patient had in you, and maybe in the whole facility. The exam will absolutely expect you to understand how serious this is.
Okay, NHA exam alert. Pay close attention to this one. An accidental slip-up that you correct is one thing, but continuing to use the wrong name or pronoun after you've been corrected, that's seen as a serious professional failure. It's disrespectful, unprofessional, and a violation of that patient's rights.
So here's a super simple way to remember it. Name plus pronoun equals respect. Make it a habit. Just ask, confirm what you heard, and then use it. Every patient, every single time. It's the most basic, powerful way to show you see them and respect them. Okay, so we've talked about professional skills. Now let's shift gears and talk about the legal and ethical guardrails that protect our patients. These are the non-negotiable rights you have to uphold.
This right here, this is rule number 1, the absolute foundation. Before you even think about picking up a tourniquet, you must explain what you're going to do and get that patient's clear, voluntary permission. It's a mandatory first step every single time.
And this is why it's not just a nice-to-have, it's a must-have. The legal stakes are sky-high. Touching a patient without their permission, even for a medical procedure, can legally be considered assault or battery. That's how serious this is. Consent is your most important tool for safety.
Think of this list as your mental checklist for every single patient interaction. They have the right to say no at any point. They have a right to privacy, a right to be treated with dignity. You can bet that the exam will have questions that touch on every single one of these rights.
This is a classic scenario you might see on the exam. So, what's happening here? The patient is withdrawing their consent. Remember, consent isn't just a one-time yes at the beginning. It can be taken back at any time, with words or, in this case, with actions. Your immediate next step? Stop. That's it. Stop, put the needle down, and find out what's wrong before proceeding.
Okay, let's clear something up that trips a lot of people up. The difference between confidentiality and HIPAA. They're related, for sure, but they are not the same thing, and you need to know why.
This chart breaks it down nicely. Think of it like this. Confidentiality is the ethical promise we make as professionals to keep patient information private. HIPAA is the federal law that takes that promise and makes it legally binding, with some very serious consequences if you break it. And when I say serious consequences, I mean it. We're talking fines that can be over $50,000 for a single violation. Sometimes it can even involve jail time. This is why following HIPAA protocol is absolutely mandatory.
Okay, this is probably one of the biggest real-world mistakes and a classic exam question. You just can't discuss patient information, or what we call protected health information, PHI, in public spaces. Not in the hallway, not in the elevator, not in the cafeteria. Any conversation about a patient has to happen in a private, secure place with only authorized people. Period. All right, we're in the home stretch. In this last section, let's pull everything we've talked about together and look at your professional image and what it really means to have integrity, especially when you're under pressure.
So your professional look, it isn't about being fashionable. It is 100% about safety and infection control. Every single point on this list is rooted in standards from organizations like OSHA and the CDC. For example, short natural nails aren't just a preference. It's because artificial nails can harbor tons of bacteria and are a huge infection risk. It's all about protecting your patient and yourself.
And just like your appearance, your language is a huge part of your professional image. Check out these simple swaps. Instead of guessing with ma'am or sir, a simple, inclusive hello works every time. Instead of using he or she when talking to a colleague, using neutral terms like the patient is clearer and avoids any chance of misgendering. It's about being precise, respectful, and professional.
So here's the key takeaway for when things get hectic, and trust me, they will. Your integrity is tested in those moments. And it means you always choose the right thing over the fast thing. No shortcuts on patient ID. No skipping safety protocols. Safety, dignity, and accuracy always win. So as you're wrapping up your studying, I really want you to think about this question. That 5 minutes you spend with a patient might seem short, but your professionalism, your kindness, your respect in that brief window can literally shape how they view the entire healthcare system. You're a vital ambassador of patient care. Remember that. And you won't just pass your exam, you'll be an amazing phlebotomist. Good luck.